Hi, I'm Dr. Austin Chang. Today I want to discuss kidney stones. So, what exactly are kidney stones and how do they develop? Kidney stones form within the urinary tract, most commonly in the kidneys and sometimes in the bladder. They are typically made from naturally occurring substances found in urine, most often calcium, sometimes uric acid, and occasionally other compounds. Over time, these substances crystallize and gradually build up layer by layer over months or even years, eventually forming a stone. Most kidney stones do not cause symptoms at first. However, problems begin when the stone starts to move. When a stone travels from the kidney through the ureter toward the bladder, it can cause significant pain and discomfort. This process is known as passing a kidney stone. How do you know if you have kidney stones? Many people only discover they have kidney stones once symptoms appear. Symptoms usually occur when the stone moves from the kidney down into the ureter. Common warning signs include flank pain, pain in the side of the lower back, which may spread to the abdomen or groin, nausea and vomiting, blood in the urine, fever, which is particularly concerning and requires immediate medical attention. The pain can be severe, and many people end up visiting the emergency department for relief. Do genetics play a role? Yes, family history can increase your risk. If kidney stones run in your family, it's important to gather details, and especially if relatives develop stones at a young age or experience kidney dysfunction. Sharing this information with your primary care provider can help guide your care. Are kidney stones dangerous if left untreated? In most cases, kidney stones pass on their own and do not cause permanent damage. However, if left untreated, they can lead to serious complications. A stone may block the flow of urine, potentially causing kidney damage. It can also increase the risk of infection, which may result in further health problems. How long do kidney stones take to pass? About 80% of kidney stones pass naturally without surgical treatment. However, this process can take several days to a week, sometimes even longer. Smaller stones may pass quickly with symptoms lasting only a few hours or a day. Larger stones may take several days or even 1 to 2 weeks to pass. During this time, you should watch for concerning symptoms such as fever, severe uncontrollable pain, inability to eat or drink normally. If any of these occur, you should contact your physician immediately. How are kidney stones diagnosed? If kidney stones are suspected, you should schedule a visit with your doctor. Initial testing typically includes urinalysis to check for blood or infection, imaging tests such as X-ray, which can detect larger or calcium-containing stones, CT scan, which is more sensitive and can identify smaller stones, ultrasound. A safe and painless option used when avoiding radiation is preferred. These tests help confirm the presence, size, and location of the stone. Understanding kidney stones, treatment and prevention. What if there are complications? In certain situations, kidney stones can lead to complications that require special attention. What if I'm pregnant and have kidney stones? If you are pregnant and develop kidney stones, management needs to be handled carefully. Diagnostic testing may differ because we try to avoid radiation during pregnancy. In these cases, it's important to consult your OB/GYN and possibly a urologist, as treatment decisions may vary to ensure both maternal and fetal safety. What causes kidney stones? For most patients, the exact cause of kidney stones isn't always clear. However, in some cases, specific medical conditions can increase the risk. When someone repeatedly develops kidney stones or has risk factors, we often perform a detailed metabolic evaluation. This includes a thorough medical history and physical examination, a review of current medications, blood tests and laboratory work, a 24-hour urine collection, which is one of the most important tests. During the 24-hour urine test, we measure various substances in the urine that may contribute to stone formation. After reviewing the results, we discuss personalized strategies, including dietary adjustments and medications, to reduce the risk of future stones. How can kidney stones be prevented? There are several general steps that help prevent most types of kidney stones. 1. Increase fluid intake. This is the most important step. Aim to drink at least 3 to 4 liters of fluids daily, around 100 ounces. Staying well hydrated keeps urine diluted and reduces the concentration of stone-forming substances. 2. Reduce sodium intake. Lowering sodium is especially beneficial for calcium stones. It also supports heart health, making it a good recommendation for overall wellness. 3. Maintain a healthy weight. Kidney stones are often linked to metabolic conditions such as high blood pressure and diabetes. Regular exercise and weight management can lower the risk of stone formation. If I already have kidney stones, how can I prevent them from worsening? Unfortunately, existing kidney stones do not usually dissolve on their own. While research is ongoing, we currently don't have reliable medications that can dissolve most stones. Management focuses on two main goals. 1. Addressing existing stones, work with a urologist to determine whether the stones should be removed or monitored. 2. Preventing new stones, collaborate with a nephrologist to reduce the risk of additional stones forming. This process is often called a metabolic stone evaluation, and prevention strategies are highly personalized. Stone prevention requires understanding your unique risk factors, so close follow-up with your healthcare provider is essential. How are kidney stones removed? If removal is necessary, several treatment options are available. Ureteroscopy. A small scope is inserted through the urinary tract to locate and remove the stone. Sometimes a temporary stent is placed to help urine flow properly afterward. Shockwave lithotripsy. This is a non-invasive procedure that uses sound waves to break the stone into smaller fragments, which are then passed naturally in the urine. It is often used for stones that are not causing severe symptoms. Your urologist will discuss the risks and benefits of each approach based on your specific case. What's the worst thing I can do if I have kidney stones? Ignoring your symptoms. While many stones pass on their own and do not cause long-term damage, some can lead to serious complications such as obstruction or infection. Even if a stone eventually passes, it can cause significant pain. Seeking medical advice early is always the safest approach. What's the best thing I can do? The best step is to work with a trusted physician over time. Kidney stones may not be completely curable, but they are highly manageable. You should work with a urologist to manage existing stones. Work with a nephrologist to reduce your risk of future stones. With proper medical guidance, lifestyle changes, and preventive strategies, you can significantly lower your risk moving forward. Thank you for joining me today. I'm Dr. Austin Chang, here to help guide you toward better kidney health.